Welcome to Module 1 of the Alberta Aids to Daily Living online training module for amplification benefits. This module will provide you with information about the amplification benefits area, including a brief program overview, eligibility requirements, cost share and cost share exemption criteria for hearing aids, contact information, and program resources. Prior to reviewing Module 2, it is recommended that you review Module 1. The Module 1 videos provide a general overview of the AADL program, the roles of the various providers, the cost share component, and the quantity and frequency review process. These are not exhaustive training modules, so it is strongly recommended that you also review the AADL General Policy and Procedure Manual, the Amplification Benefits Manual H, and the Approved Product List. This section provides you with a summary of the AADL Module 1 training videos. There are several modules that provide an overview of the AADL program. Module 1.1 through 1.7 should be reviewed prior to the Amplification Benefits module in order to gain a comprehensive understanding of the AADL program. These modules review the roles of the various providers within the AADL program, the cost share component, the complaints process, and how to request a quantity and frequency review. The Amplification Benefits module provides additional details specific to the provision of amplification devices. This section discusses the general eligibility criteria for AADL funding that applies to all clients. Albertans are eligible for benefits if they have been diagnosed with a long-term chronic disability and meet specific eligibility criteria. Benefits are provided to support individuals to live as independently as possible and to participate in daily activities in their communities. Funding is designed to meet basic needs for medical equipment and supplies. The program is not designed for individuals with a temporary condition. If you have not already done so, please review Module 1.1, which provides a general overview of the AADL program. You should also have reviewed the General Policy and Procedure Manual, the Amplification Benefits Manual, and the Approved Product List. It is the provider's role to ensure they understand AADL policies and procedures, client eligibility, and the cost share requirements for amplification benefits. Providers are accountable for the decisions they make in authorizing equipment and supplies in accordance with AADL policies and procedures. In order to receive AADL benefits, clients must be a permanent resident of Alberta. Permanent residency is defined as being physically present in Alberta for at least 183 days in any 12-month period. 183 days amounts to just over 6 months. New residents from other provinces are usually not covered until the first of the third month after they arrive. When clients move from another country, they may access amplification benefits as long as they have an active Alberta healthcare number. They are only eligible for cost share status during the first 12 months of their residency. Out-of-country clients cannot apply for cost share exemption until they have resided in Canada for 12 consecutive months and filed an income tax return with the Canada Revenue Agency. Refugees may have access to federal or provincial funding depending on the circumstances of their arrival. You should check with AADL prior to the provision of benefits to determine eligibility and funding sources. Before considering a client for amplification benefits, it is important to ensure AADL general eligibility criteria has been met. It is then the responsibility of the provider to find out if the client meets the specific eligibility requirements for the amplification benefit itself. If not, providers will need to advise clients to pursue other funding options. Clients are not eligible for AADL funding if they receive similar benefits through other programs such as the Workers' Compensation Board, Department of Veterans Affairs, non-insured health benefits, federal programs such as RCMP and Armed Forces, motor vehicle accident claims, correctional institutions, and private insurance plans. Clients with private insurance that covers 100% of the cost of the benefit are not eligible for the same benefit under AADL. Once the private insurance coverage is exhausted, the client may become eligible under AADL. Clients should determine private insurance before accessing AADL benefits for amplification devices. This section discusses the specific eligibility criteria for amplification benefits. Providers for amplification benefits include registered audiologists who work for Alberta Health Services and in private practice. They also include registered hearing aid practitioners who work in private practice. AHS audiologists typically provide service for bone-anchored hearing devices and cochlear implants. Alberta Children's Hospital supplies amplification benefits for the pediatric population. Private practice audiologists and hearing aid practitioners provide services for the general population requiring hearing aids, related products, and services. Pediatric clients must be assessed and treated by audiologists. Amplification benefits available to eligible clients include hearing aids, personal listening devices, remote microphone hearing assistive technology systems, otherwise known as FM systems, bone-anchored hearing aids, cochlear implant processors, ear molds, and repairs. Please refer to Manual H and the approved product list for specific information regarding the provision of these products. To be eligible for an amplification device, clients must have a permanent hearing loss confirmed by a registered audiologist or registered hearing aid practitioner. Hearing impairment is considered permanent if it is irreversible by medication or surgery and is likely to last for a period of 6 months or more. This includes conductive impairment associated with structural anomalies of the ear. Permanent hearing loss must be supported by a diagnostic audiogram. Children under the age of 18 are covered for amplification benefits as per the approved product list. Children must be assessed and treated by a registered audiologist. Children 0 to 6 must be fit following the pediatric amplification protocol published by Alberta Health Services and the Alberta College of Speech-Language Pathologists and Audiologists. This manual is available for download on the AHS and AXLPA websites. The hearing loss criteria for children is slightly lower than adults due to speech and language development. AADL does not provide amplification benefits to children that do not have a hearing loss but have other disabilities such as auditory processing disorders, autism, or learning disabilities. ABR criteria is discussed in the AAHS AXLPA Pediatric Amplification Protocol. If you are unclear as to whether an infant meets AADL hearing loss criteria, please contact the AADL Amplification Benefits Manager. Adults must display the following degree of hearing loss and must be motivated to wear a hearing device. Amplification benefits are not provided for clients with normal hearing and tinnitus. There must be evidence of a permanent hearing loss on a diagnostic audiogram. Clients between the ages of 18 to 64 are not typically eligible for hearing aids unless they are eligible for cost share exemption based on the income thresholds identified by AADL in the General Policy and Procedures Manual, or they receive assistance under AISH, or they are a full-time student. Clients of all ages are eligible for cochlear implant and bone-anchored hearing devices if they meet the hearing loss criteria. Full-time students must be between the ages of 18 to 24 and must be listed as a dependent on their parents' healthcare plan to receive benefits. If they are not on their parents' plan, they are considered an adult and would have to apply for cost share exemption status. Cost share exempt adults are not eligible for FM systems, so it is to a student's benefit to be enrolled as a dependent on their parents' plan. Full-time students are eligible for all benefits available to those under 18 years of age indicated on the Amplification Benefits Approved Product List. Proof of full-time educational enrollment is required. To receive hearing aid benefits as a senior, clients must confirm their age by submitting a proof of age form to Alberta Health or by completing an Alberta Seniors Financial Assistance application form. Albertans are eligible for seniors hearing aid funding the first of the month following their 65th birthday. This section discusses cost sharing as it applies to amplification benefits. In this section, we will discuss cost sharing as it pertains to hearing aid benefits. Please review Module 1.5 and the General Policy and Procedures Manual for detailed information regarding coverage and household income requirements. The AADL benefit year runs from July 1st through June 30th. Some clients may need to reapply for cost share exemption status if they are not automatically enrolled as cost share exempt in the following benefit year. Low-income seniors may be eligible for additional financial assistance through the Special Needs Assistance Program for seniors. The income requirements for hearing aid coverage is lower than other ADL benefits. Therefore, it is important that seniors complete the appropriate application forms. To be eligible for the Special Needs Assistance Program, clients must be 65 years of age or older, be an Alberta resident, be a Canadian citizen, or have been lawfully admitted to Canada for permanent residence, meet financial eligibility criteria, and have provided a seniors financial assistance application. Clients younger than 65 should complete the general cost share exemption application form. Clients over the age of 65 and their adult dependents who need hearing aids must complete the cost share exemption for hearing aid benefits for seniors. This form assesses the client for ADL cost share exemption and for additional hearing aid funding. Clients may be cost share exempt for hearing aids only and still be cost share for all other benefits. The last page of the cost share exemption for hearing aid benefits for seniors outlines the income requirements for general cost share exemption and the requirements for hearing aid cost share exemption. If the client's income exceeds the amounts listed based on their most recent income tax return, or they have not submitted a tax return in the past year, their application will be denied. Cost share exemption applications must be faxed or mailed to ADL Client Services. They should not be emailed due to privacy laws. Specialty suppliers can verify cost share exemption status through the Alberta Blue Cross online health portal patient inquiry page. If the application is approved, the Alberta Blue Cross online portal will be updated within 2 weeks of application receipt. If the application is denied, the client will be sent a letter within 2 weeks of application receipt with an explanation of why their application was denied. With respect to cost sharing, each family is assigned one of the following cost share statuses. Cost share means that ADL pays 75% and the client pays 25% of the ADL price limit. Cost share max reached means that the maximum $500 cost share portion has been paid by the family for the ADL benefit year of July 1st to June 30th. Once the maximum has been reached, the client does not have to pay the 25% cost share amount. AADL will pay 100% of the AADL portion of the approved product. No further cost share payments are required for the benefit year. Please note that this does not mean that the client becomes cost share exempt and is eligible for 2 hearing aids. Cost share clients would get $1,200 towards 1 hearing aid instead of only $900. They are still responsible for upgrades and the full cost of the second hearing aid. The $500 max applies to all benefit areas combined, not just amplification. For example, if the client used the $500 on a wheelchair, he would have reached his cost share max, therefore would receive the full $1,200 towards 1 hearing aid instead of only $900. Cost share exempt means the client gets 100% of the ADL portion. For hearing aids, that typically means a client gets $1,200 per year. Temporary cost share exempt means the family is exempt from paying cost share until the end of the current benefit year. The family may have to reapply for cost share exemption in the next benefit year if they are not automatically enrolled. Cost share and cost share exempt amounts, quantities, and frequencies are outlined in the Amplification Benefits Approved Product List. Here is an example of a hearing aid purchase for a cost-share client that purchased one hearing aid that cost more than $1,200. As per the APL, ADL pays a maximum of $1,200 towards one hearing aid for a cost-share client. ADL pays 75% of the $1,200. The client pays the remaining 25% plus the upgrade. In this example, the hearing aid costs $1,400. Therefore, ADL will pay $900 towards the hearing aid, and the client pays the remaining $500. Here is an example of a cost-share client that purchased one hearing aid that cost less than $1,200. Because the hearing aid is less than $1,200, ADL pays 75% towards the $1,000, which amounts to $750. The client pays the remaining 25%, which amounts to $250. Here is an example of an upgraded hearing aid purchase for a cost-share senior with a cost-share maximum of $500 reached. As per the APL, ADL pays a maximum of $1,200 towards one hearing aid for a cost-share client. If the advertised price is less than $1,200, the advertised price is billed to ADL. In this example, the hearing aid cost $1,400. Therefore, a cost-share senior is eligible for a maximum of $900 towards one hearing aid. However, the client contributed $500 in cost sharing towards a wheelchair within the same benefit year prior to obtaining hearing aids. As a result, the senior is eligible to receive the full $1,200 towards the one hearing aid. The client is still responsible for the remaining $200 upgrade cost. It is important to note that reaching the cost share contribution does not make the client cost share exempt or eligible for two hearing aids. They are just not required to pay the cost share portion toward the one hearing aid after the $500 limit has been reached. The following example is for a pediatric client. The pediatric client purchased two hearing aids that cost more than $650, which is allowed on the APL. Two ear molds at the APL price of $70, and an FM system that costs more than $1,900 as per the APL. As a result, the client reached the maximum $500 contribution they are required to pay, so ADL pays the remainder of the cost share portion. The client is still responsible for upgrade costs. Please note that the fitting fees have not been included in this example. Typically, there would also be hearing aid fitting fees and FM fitting fees included in a pediatric fitting. In this module, we discussed how to access the training modules for the ADL program and amplification benefits area, general eligibility criteria for the ADL program, specific eligibility criteria for amplification benefits, and cost share exemption criteria, and how the Special Needs Assistance Program for seniors pertains to amplification benefits. In the following module, we will discuss provider roles and responsibilities, how the approved product list applies to amplification benefits, fitting and verification requirements for amplification devices, and the QFR process. Thank you for completing Module 2.81. In the next module, you will find more information about provider roles and responsibilities, specific information on the approved product list, fitting and verification requirements for amplification devices, and how to complete QFR requests for early replacement of amplification devices.